All right, wrist fractures, wrist and hand fractures. I just want to say if you have any fractures of the bones of the fingers and that's all that you have, that's great. Oftentimes they're associated with tears of the ligaments also, and that you need to see a hand specialist to see if it needs to be repaired. Sometimes baseball guys can have fractures of the hamate. It's this little bone in the corner of your hand here. Sometimes it can heal conservatively. Other times they just need to take that cracked portion out. Pretty quick to recover from, but sometimes a pain in the butt. So if you fall or something like that and your fingers are all screwed up, go see a specialist. Go to the emergency room and have them refer you to a hand specialist because you might have some damage to the tendons there. You want to rule that out. Sometimes you can fracture the wrist when you fall. Sometimes if you fall like this, a foosh fall, so it's called a fall on outstretched hands, so F-O-O-S-H. Sometimes you can fall towards the back, and you can fracture the wrist here. One of the most common injuries is called a Colles fracture. It's a fracture of the distal portion or the lower portion of the radius, and it most commonly the radius, the bone here, kind of flicks upward, so it looks like you have another lump here. If you fall and that happens, you definitely need to get yourself some immediate help real quick. You could go to emergency room, get an x-ray, and get that fracture reduced. You'll have it set, and then you'll need to come back in for PT once that bone is almost all the way healed to restore your motion, restore your strength. And the same thing with all the fractures as well. Oh yeah?